My wife asked me which hospital that I want to go to, and I told her I want to go to Manistee, because I knew time was of the essence.
A medical emergency is different for everybody, but ultimately it boils down to something that needs to be treated or seen right away. It can be serious, it can be life-threatening, it can be dangerous, but it needs to be seen right away.
I woke up at 4 a.m., crushing chest pain. Thought it was, some indigestion. Quickly realized when the pain started radiating down both my arms, it was not indigestion. Being a nurse myself, I realized I'm having a heart attack.
So I got up and we're trying to call 911 at that time. And we don't have 911 services at our house.
My family was scared. My son was, I could see the fear in his eyes.
Got him in the car and started calling 911 the entire trip down until we could get somebody to meet us with an ambulance.
So got me in the ambulance, hooked me up to the EKG, and realized I was having a STEMI, which is critical, having heart damage, heart attack. So got me to the hospital and confirmed again by EKG that I was definitely having a heart attack. Hospital staff was very attentive. The physician was very attentive as well, and basically got me some medications that could open up my blood vessel to help save my heart.
When patients come into the emergency room, they can be frightened. They might be thinking they're having a heart attack. They might be dying. So they're very scared, very nervous about what's going on.
We see roughly about 15,000 patients a year in the emergency department currently. That's just about double what we saw the last time the emergency department was renovated, which was in 1991. Our emergency department offers amazing care. We have a great group of providers. They do a wonderful job, but they're cramped. The space is not great for them to work in, and we just need to improve their abilities to continue to provide great care to the community.
One of my biggest concerns about the emergency department setup is the lack of privacy for patients. Several of our rooms are semi-private, which means there's a curtain in between, and so you can be next door to somebody else going through a crisis and you can hear what's going on. And for your own self, you don't have that privacy for your own self as well as a patient.
The privacy issue is very important because most of the time in a small town like this, you either know the nurse or you know the receptionist or you know the patient that's in the next room, and those kind of things make it a lot harder for you to feel at ease and comfortable in the emergency department. The overall goal of the campaign is to renovate the emergency department in such a way that we can provide a safer, more private, and more spacious area to provide the great care that our emergency department currently does.
Since receiving this care that I've received at Munson, Manistee, and Munson, Traverse City, I mean, I owe them my life. I mean, they saved my life. You know, they've kept my family together. So it means the world to me.
This community, being the size that it is, being the distance that it is from other facilities, our ER department here has to be on their ball with everything. I mean, stroke victims, heart attack victims, every emergency that comes through the door.
The necessity of having an ER that's capable, you know, and to be able to attract physicians that want to be able to practice, you know, in the ER. You know, having an up-to-date ER that can take care of the patient needs, it's huge.
Please help us provide the safe, secure emergency care our community needs with a generous gift to the Manistee Emergency Department campaign.